Good evening, everyone. Hello. So we are again back on Sunday live sessions with me, Dr. Tanima Singhal. Before we start our session, a little about myself. My name is Dr. Tanima Singhal. I am owner of Maa-Si Care Clinic and Foundation, and I have my clinic set up at Lucknow, but we also do online consultations. Today, our topic is about breastfeeding preparation during pregnancy. A brief about myself. I am a doctor with 12 years experience in obs and gynae. My basic graduation is in Ayurveda and my post graduation is in reproductive child and health. Since 3 years I am working as a childbirth educator, lactation consultant or a counselor and Garbh Sanskar expert. So the different points which we are talking about, what a pregnant lady should remember and which will help for breastfeeding preparation during her pregnancy is, first of all, exercise and yoga. This is a very important thing which all pregnant ladies should remember. You first need to talk to your gynecologist about whether you are medically fit for going for any pregnancy yoga or exercises. Second thing is, always consult an expert, a prenatal yoga expert or a physiotherapist who is very good at prenatal exercises. Then only do any kind of exercises or yogasans, because posture is very important. Now, what are the benefits of exercise or yoga if done during pregnancy for breastfeeding? It will help your endorphins to release, which is very good for your overall health, and also it will help in the equal distribution of blood across your body. Your joints will be more flexible, which is going to be helpful more after your delivery also. Also, it will help you for your natural childbirth. Second thing is good rest. Good rest is very important. You should have like 6 to 8 hours good sound sleep, uninterrupted sleep in the night, and 1 to 2 hours sleep in the afternoon. Next is Garbh Sanskar. What is Garbh Sanskar? A lot of women ask me, what is Garbh Sanskar? Garbh Sanskar is a method. It's nothing new, but it has been practiced by our ancestors and it has been given to us. This knowledge is mentioned in our ancient text. It is about how you can connect with your baby during pregnancy inside the womb. So I hope you have heard about the story of Abhimanyu during Mahabharata, how he knew about to enter Chakravyuh from his mother's womb. So I am not going too much details. We'll take a separate session on Garbh Sanskar, but it has numerous effects of being a good breastfeeding journey after your delivery also. Now connect with your baby and talk to your baby while the baby is inside the womb. Again, I am telling, this has got various benefits, and I see some mothers are with me right now who have done Garbh Sanskar with me, and they are knowing it very well about what are the benefits of Garbh Sanskar. So Garbh Sanskar is very important. When you are talking to your baby, you can let your baby know what you want from your baby. You can share what you feel for your baby. You can share about what kind of things you want your baby to be, and you can share your dreams with your baby. Believe me, after your delivery you will see lot of benefits into that. Then next point is, you should wear a comfortable bra during pregnancy. Many times mothers ask me, I don't need to wear a bra, what? No, you have to wear a proper, good, comfortable, full covering bra. And why is it so? Because during pregnancy, the breasts have a natural tendency to increase their size. And don't worry, moms. Please, many times mothers are so worried, why is this happening and all that. Don't worry, it will all be okay. Okay? Now, what are the benefits of wearing a good comfortable bra is that after your delivery, your breast will not sag. Many times mothers ask me that what to do for sagging of breast. So this is going to help you a lot. Next, always talk to your doctor. This is a very important point. Please remember that. Talk to your gynecologist about initiation of breastfeeding within half an hour. This is very important. You should please remember that, to talking to your gynecologist. Initiation of a first half an hour after delivery is the golden period. You should always talk to your doctor to start breastfeeding within half an hour of delivery. Whether it is a cesarean section or it is a normal delivery, you can have initiation of breastfeeding starting from the OT table also. Okay, so please always talk to your gynecologist about it. She will make it a note that she will start early initiation of breastfeeding so that your breastfeeding journey will be successful. Now, also talk to your doctor or your hospital staff about exclusive breastfeeding. Most of the mothers tell me that my baby was started formula milk during hospital stay and I was not aware of that. So always remember, first you get good education about what are the techniques of breastfeeding, because this is a very important thing, and then you talk to your doctor about it that I want to exclusively breastfeed my child. Also remember, a newborn child, the baby's stomach capacity is only 8 ml. So the hospitals, when they are giving in NICU or in the ICUs or during the hospital stay, sometimes they are feeding 20 to 30 ml formula milk, which is not required at all. So you can talk to your gynecologist or your doctor or your hospital staff that I want to exclusively breastfeed my child, and from pregnancy itself and just after delivery you can start like expressing the milk. It will come, don't worry about that. Small amount of milk which is coming, that is called as colostrum, and that is very important, and that is sufficient for the child for initial 2 to 3 days. Okay. Now next thing is very important is to carry nursing bras, pads, comfortable clothes, front open gowns while you are in the hospital. Sometimes mothers usually don't have these things in their hospital bag, and then there is always a rush like what to do, what not to do. Also carry this hot water bottle with you so that you can do hot fermentation while you are in the hospital just after your delivery, so that your breast milk comes down easily. Then also remember to prepare a good comfortable nesting space in your home right now while you are pregnant, because as soon as you will be coming back from the hospital, you should have a good nesting space where you can breastfeed your child comfortably, where your positioning is very good, you are good posture. So you should have good comfortable pillows with you, you should have good comfortable chair where you can properly sit and breastfeed your child. Also you can have a rocking chair if you have at your home. Then just have a good nesting space with some positive photographs around you, some good music around you which you can hear, or some books around you which you can read while you are breastfeeding your child. Next is KMC. KMC is kangaroo mother care, and kangaroo mother care is very beneficial for a mother to understand, and the benefits of kangaroo mother care are known to everyone. If you are hearing for the first time about kangaroo mother care, please get a good information about kangaroo mother care. Kangaroo mother care technique, if learned by a pregnant mother during her pregnancy itself, will give lot of numerous benefits after her delivery. Most of the doctors advise for doing kangaroo mother care to the mother, but sometimes she is not knowing about what is kangaroo mother care. Kangaroo mother care, please practice that. Find it on the internet. You will get lot of information on kangaroo mother care. Still, if you don't have much information on that, you can contact us. We will provide you a good information on kangaroo mother care, and also I'll take a session on kangaroo mother care. Now last, please join a lactation preparedness class during your pregnancy. This is a very important thing. Mothers, while they come to me after delivery, because I take breastfeeding counseling sessions, when they come to me, they say, we didn't know about all this. This is all very new to me, what you are talking about. So if I wish I would have learned these things in my pregnancy. So women, and this is a message to all the society people who are watching or who will be watching this video. Please ensure that a pregnant lady should attend a lactation preparedness class during her pregnancy. If you know about someone who is giving these classes, please go and attend. And suppose if you don't know, you can let us know, because we take online sessions also for lactation preparedness class for pregnant ladies. This is a 1 hour class where we teach all the basic concepts which a lady should know about breastfeeding in the initial weeks of delivery. If you want to know more about it, you can just message or call on our clinic helpline number 860-480-3205 and let us know if you wish to join our class for breastfeeding preparation during pregnancy. Now last is, always talk to an expert about any kind of difficulties if you are facing during breastfeeding. Yes, we have our good support system at home, but sometimes the information which is passed on to us is very outdated. I am not against any kind of information, but sometimes when I see mothers who are practicing those kind of things which are not required these days, I really feel that we need to just understand and learn new techniques, new things which are very relevant for breastfeeding these days. For a good breastfeeding experience and for a good breastfeeding journey, some techniques have to be learned properly, like good latching, deep latching techniques, about cross cradle hold. All these hold and positions are very important for a successful breastfeeding journey. So always talk to an expert. And who is an expert? A lactation counselor or a lactation consultant is the correct person for whom you should reach out for any kind of breastfeeding issues. So anybody who is facing any kind of issues related to breastfeeding can reach out to us, or in your city just go out and search out for a lactation consultant or a counselor and get yourself properly diagnosed or properly treated for any kind of breastfeeding issues. You can also let us know if you are having any kind of breastfeeding issues. We'll be there for you and we'll guide you and help you and support you for the same. Hopefully today's session was of good use to you and you learned something new. If yes, please drop in your message or your comments on this so that I know that you learned something and also you like the information shared. Thank you so much. Have a nice Sunday.